Doctors initially believed that little Joy had a small tumor in her abdomen. But as the investigation continued, they discovered something horrifying. How could a child possibly be having such a life-threatening tumor? Find out in today's story that takes an unexpected turn. Please also let us know where you're tuning in from. The car was swaying violently from side to side as Jonathan sped through the traffic. His wife Sarah was screaming in pain in the back seat. She had gone into premature labor and was convinced that something was terribly wrong. They needed to get to the hospital as quickly as possible. While Jonathan rushed her to the emergency department, he tried to provide all the necessary information about his wife. Sarah could barely speak. The pain of labor was unbearable. The doctors needed only one look at her to realize that she had to be taken to the operating room immediately. Her blood pressure was dangerously high, and the baby was showing signs of distress. As Dr. Matthews washed his hands along with his colleagues, he couldn't help but comment on the nature of the C-section. In her personal file, the obstetrician-gynecologist noted that the baby was unwell. The doctor suspected that she had an underdeveloped liver, which had led to the development of a terrible tumor. They were deeply concerned about whether they could extract the baby in time, so they worked at double speed. They managed to perform a spinal block, keeping Sarah conscious. Although she was distraught over the possible loss of her child, with each passing moment, her condition worsened, until suddenly a cry was heard. It was weak, but it was there. She desperately tried to get the doctor's attention. She longed to see her baby, but she was being ignored. Sarah saw nurses approaching her, and then suddenly, everything plunged into utter darkness. Jonathan was beside himself. He had just seen his wife go completely limp. He screamed, calling out for someone to help her. He was convinced that she had just died. The doctors frantically began stitching up the wound. Blood was everywhere. She had started bleeding. While the doctors worked tirelessly to stabilize her, the nurses attended to her, trying to bring her back. Jonathan's vision blurred. He didn't know what to do. It was then that a nurse directed him to his little girl and asked him to focus on her. He was utterly overwhelmed when he saw her for the first time. He could hardly believe his eyes. She was there and looked so good. Her tiny pink body seemed as strong and healthy as it possibly could be at that age. He was so captivated by her beauty that he almost forgot about his wife. When he turned his attention back to her, he felt sick. Now the doctors were applying electric shocks to her, trying to get her heart to work again. Jonathan simply leaned over his little girl and began praying as fervently as he could. He prayed to God to keep his wife healthy and unharmed. Everything was unfolding in a way he never imagined. Sarah had been so happy and excited to learn that she was pregnant. It was utterly wrong for things to end like this. Just as he was about to pray again, he suddenly heard the nurses getting agitated. Sarah was coming back and slowly regaining consciousness. It was a miracle. He immediately asked the nurses to bring his daughter to show her to his wife. He wasn't sure how long Sarah would remain with him and wanted to ensure that she met her child. Sarah saw the little angel who had lived in her womb for the past 8 months. She was so grateful to be alive. After that, the nurses had to take the baby away, saying that some tests needed to be done. Sarah and Jonathan's hearts filled with fear. They knew the baby was premature, but they wondered how it would affect her condition and whether she would be all right. Sarah's blood pressure spiked dangerously, forcing her to be given a sedative. Poor Jonathan was left almost alone. He had to face the grim reality that something was seriously wrong with his daughter. He was at a loss, not knowing what to do, but the hospital made the decision for him. They simply told him that he must remain in the waiting room and wait. They wouldn't allow him to roam the hospital agitated and indecisive. Of course, this only made him angrier. He needed to know what had happened to his daughter. While Sarah was slowly coming out of the sedative-induced state, they tried to calm her as much as possible. Naturally, she was desperate and wanted to know what would become of her daughter. Jonathan explained everything he knew to her, and then he was forced to sit and wait. You can imagine that when the doctor first entered the room, they nearly pounced on him. They were determined to find out what was going on. The doctor's expression said it all. The news was bad. When he spoke, it was as if a blast of icy wind had burst through the door. Something was seriously wrong, though they couldn't quite pinpoint what. The baby refused to eat, and her stomach was severely distended. "We need to continue our investigation before it's too late," the doctor said. The young parents could hardly think clearly. This was truly the worst-case scenario. If they couldn't determine what had happened to their daughter, they might have to leave the hospital without her. The mere thought of that made Sarah shudder and burst into uncontrollable sobs. But then she remembered the tumor in her liver. She quickly began explaining to the doctor everything about the suspected tumor that the radiologist had mentioned during the last scan. They had mentioned something about a small tumor in the liver that was of great concern. Sarah was convinced that this was the cause of her daughter's problems and insisted that they continue the investigation. It became immediately clear that the doctor was considering this possibility. He looked as if this theory made perfect sense to him. He told the parents that he would look into it and promptly left the room. The doctors allowed Jonathan to accompany his daughter for all further examinations. They started, as Sarah had suggested, with the abdomen. They examined it meticulously to identify the problem. Of course, there was a noticeable mass there, seemingly unattached and just floating. Naturally, this raised concerns. Where had it come from? What was it? After Jonathan saw it, his thoughts were thrown into disarray. If his little girl had been born with cancer, how could this have happened? Sarah had been an exceptionally healthy person who did everything right during her pregnancy. Ever since she found out she was pregnant, she had strived to do her best. She had given up coffee, not touched a drop of alcohol, eaten healthy food, taken all the necessary vitamins, and rested well. When Jonathan inquired about cancer, the doctors merely dismissed his worries. They said there was no reason to be overly anxious for now. They had no idea what it was. Additional tests were necessary. They tried to avoid using contrast-enhanced scanning, but now it seemed like the only viable option before surgery. They prepared everything needed and immediately got to work. They had to inject dye into the patient's organs to see what they were dealing with. She was simply too small for a standard scan to work as precisely as required. So they slowly introduced the dye into the patient's abdominal cavity and carefully observed the screen for any irregularities. Then suddenly the doctor abruptly halted the examination and left the room. This was, of course, extremely unexpected for Jonathan. What had the doctor seen? Why had he reacted so strongly? The longer Jonathan pondered the matter, the bleaker the prognosis seemed. He was nervous and fearful of what might happen, but no one could prepare him for what he was about to learn. When the doctors returned to the room, they looked frightened and slightly confused. However, as they began to explain, the situation started to make sense. They explained that the baby was experiencing something unlike anything they had ever seen before. It was an exceedingly rare occurrence. Jonathan could hardly believe his ears. As the doctor explained, the situation grew more and more surreal. It appeared that there was a fetus in her abdomen. A fetus inside her abdomen. What kind of science fiction nightmare had Jonathan found himself in? He kept waiting for it to be a bad dream, but it never ended. In his confusion, he began to ask questions. The doctors provided a simple, though disheartening explanation. This happens extremely rarely, but it does occur when one twin may absorb or swallow the other. In such cases, the fetus may end up in the abdominal cavity of the other. It was even more horrifying. The thought that Sarah had been carrying twins, only for one to consume the other, was both bizarre and unsettling. Fortunately, the doctors had a solution. They explained that if they were careful enough, they could extract the fetus from the abdominal cavity of the baby, and she would likely remain unaware of the ordeal. However, they needed to proceed with the operation as quickly as possible to prevent further damage. Since Sarah was already in a state of distress, Jonathan simply told them to do whatever was necessary. He knew that all his wife wanted was for their healthy child to be with them. So the little girl underwent an operation that would change her life. The doctors meticulously removed the unnecessary tissue. At this stage of the fetus's development, her growth measured just 2 inches. It was frightening given how small the baby was. Nevertheless, they were relieved when they successfully extracted the fetus. This meant that the child could now be nourished better and potentially lead a normal, carefree life. Jonathan and Sarah were immensely grateful that their little girl was improving. Yet the notion of the twins' birth remained a bittersweet dream, and the realization that there could have been 2 brought a pang of pain. Still, they believed that God had a plan for everyone. Their little girl ended up on the list of the rarest patients of our time. She truly was one of a kind, and thanks to exceptionally high-quality medical care, she continued to live her ordinary life. Dear listeners, what do you think of today's story? Let us know in the comments below. And if you enjoyed this video, please like and subscribe to our channel.